Hello, everybody. Welcome back to another edition of Hyperbaric Gurus with your host, Brad Heward. I'm here with Bill and John, our doctor, and Bill is our hyperbaric. One second here, we got phones on. John's going to go over there and mute that for us. And hold on. So we're going to go ahead and start talking here. Today we're going to be talking about heart disease and the complications of heart disease, how people get it, how they can respond to it, how they can get treated for it. And before we got the phone call interrupted us there, I was going to introduce Bill here, who sells hyperbaric chambers. He's been around it for years and years and years. He also works in the hyperbaric industry. He knows the pros, the cons of what chambers can and what they can't do. So, Dr. Cornell, how was the phone call?
I was wonderful.
Okay.
My daughter, she's having heart problems.
So I'm going to go ahead and start with Dr. Ask him a few questions, and then we'll move over to Bill and get his opinions, or we'll ask him some questions on what I'm about to ask John here. So I'm going to give you, we got a new microphone here. We're getting pretty classy right now.
This is really classy.
So, John, tell us a little bit about what you know about heart disease.
Well, there's many different types of heart disease. It's not just one form. There's heart attacks, which is a blockage of an arterial and an artery that goes to the heart that brings all the nutrients to it, and obviously red blood cells with hemoglobin, which carries oxygen. And I think that's probably more what we're going to be talking about is problems with oxygen here, since we are hyperbaric in this clinic, and we sell hyperbaric chambers. So if that's the case, oxygen not getting to the muscle, which the muscle is the largest muscle in a male's body. It's the second largest muscle in a female's body, and it needs oxygen to get into it so the muscles can function, and it needs to get carbon dioxide away from it. So it builds up carbon dioxide as it's using the oxygen in the body. It builds up carbon dioxide. So I think that's the main thing, that if you look at any type of myocardial problems, and especially myocardial infarction, which means that the red blood cells and the hemoglobin aren't getting oxygen to the body, and therefore the muscle can't work. And if it doesn't work properly, then it goes into spasm like any other muscle in the body that doesn't get oxygen and doesn't get rid of the carbon dioxide. Goes into spasm and you have a heart attack. So that's heart attack simplified. But you have to get oxygen in and carbon dioxide away from a muscle, any muscle in the body.
So I got a question for you about heart attacks, since we're talking about that. There's a few other things we'll get into when it comes to heart disease, but with heart attacks, what causes the pain in the chest? Because that's usually the first thing people notice when it comes to a heart attack. The first thing they see is, I got pain. Why is my chest hurting? And they don't think anything of it until they fall over, and then it's too late. So can you explain to me, do you know?
That's simply the pain in any muscle, and the heart's a muscle. Like I said, it's the strongest muscle in a male's body. It's the second strongest muscle in a female's body, the uterus being the strongest in the female's body. So it's a muscle that's working. If it's not getting oxygen in and carbon dioxide out, it goes into spasm like any other muscle. If you've had a cramp, any muscle cramp in the body, in your bicep or the calves or the thigh or whatever, that pain. That's the same type of pain you get from the heart, which is a muscle, when it goes into spasm. And if it goes into spasm, then it's not pumping everything into it, oxygen in, and it's not getting rid of carbon dioxide out. And if it doesn't do that, the muscle goes into a spasm and causes pain.
Okay, cool. So, Bill, let's. I'm gonna hand this over to you. So now I just got a message here from one of our viewers saying they couldn't hear us too well. So I'm not too sure how good our microphone's working or not. We just got it, so bear with us here as we try to figure this out. So. Hello. I mean, it's showing on our bar that it's receiving pretty good. So maybe maybe it is working, maybe it isn't. I don't know. So, 1 second here, guys. We're having a.
So, what was your question, Brad?
Well, I was gonna ask Bill what your thoughts were on, John just explained a little bit about, hold on here, we're having some technical difficulties, but what your thoughts were on that. You've been around hyperbaric therapy for a long time. You've seen a lot of patients come in and out. You sold a lot of chambers. What have you seen as far as patients you've dealt with who have had heart attacks? Things like along those lines.
Well, when somebody has a heart attack, what's the first thing they do? They give you an oxygen mask. Well, in Japan, they actually have a hyperbaric chamber in many of their ambulances, so that on the way to the hospital, the people are having oxygen forced into the cells and tissues. So they're not just breathing the oxygen through a mask, but the pressure is forcing that oxygen into the cells and into the tissues. It just makes sense that that's going to be much more of a profound effect. One of the things that the hyperbaric chamber does, though, for the heart attack victim is it repairs and rejuvenates damaged cells, and it builds new blood vessels in damaged areas. So the chamber is probably, well, first of all, it's endorsed by the American Heart Association. Many of us don't when we think of a heart attack, many people relate that to a male issue. They don't realize that how many women also have heart attacks. And we actually have a lot of paperwork here in our clinic. More women than men, is that right, John?
So you said more women than men?
Yes, have heart attacks. It's mostly, people do think of males having heart attacks, but there's more women than men that have heart attacks. That's the statistics that just came out in the last 2 years.
Wow, that's fantastic. And what we'll do is I'll have our Facebook person tomorrow put up some information about that too, so you can read that at H3 Therapy's Facebook.
So the chamber is endorsed by the American Heart Association. We have some really, really good articles here in our clinic that if somebody's interested in reading about it, if you email us or call us, we'll be glad to send those out to you. We can email them to you so that you can read what the American Heart Association has to say about hyperbaric therapy and heart disease. But, if we go back to what the hyperbaric chamber does, it's building new blood vessels in damaged areas. It's repairing and rejuvenating damaged cells. It's forcing oxygen. It's improving your circulation, the blood and oxygen flow throughout your body. So it's not just any one specific thing. It's a combination of everything that's creating the benefits. And the sad thing is that we live in a reactive society instead of a proactive society. Why do so many professional athletes own hyperbaric chambers? Because it's forcing oxygen into the cells, into the tissues, and into the body fluids, enhancing their performance. If they're doing that, what does it do for the average person? Wouldn't it be good for them to be having oxygen forced into their cells, tissues, and body fluids on a consistent basis? And what would that do for their health? So, the chamber does a lot more than that. But when it comes specifically to health issues, if I had a heart attack, or if I was at risk of heart disease, I think I would be spending an hour a day in the hyperbaric chamber, trying to be proactive about my future instead of reactive, like I have been in my past. So,
okay, so back to heart disease. We have a stream of questions coming in, which is pretty fantastic today, and we're not even to our questions section yet. So we may jump a little bit earlier to our questions section. Instead of doing it normally, we do about 5 minutes before. We may do a little bit more because we have so many questions. So back to with heart disease. That's it was a little bit tougher one for us this week because we have had patients come in, but most of our patients have had stroke. We have some MS patients, things like that. But would you say Lyme disease? And with heart disease, that's one of those things that a lot of people have issues with their heart, and it's mainly because their diets or what they're doing, relaxing. And that, to me, now, correct me if I'm wrong, and I'll let you answer this question that I have. If I'm sitting there, relaxing every day, watching TV, sitting in a chair, working on a computer, doing that, and then I go home and I relax more, will that make my heart actually get weaker and weaker over time because I'm not exercising and running and or just doing anything that could sorry about that, do anything that could give me exercise?
Well, exercise is really important. And what does exercise do? Exercise builds up your body to physically be able to handle stress better. Stress is what a heart attack is, stress on your body. It's stressing one of the major muscles in our body. We have two major systems that keep our body running. And one of them is the brain and the spinal cord system and all the nerves that emit from that. And the other thing is our heart, which we're talking about tonight, which has to have food, oxygen, and so forth to keep those muscles working. So I think stress is one of the things that, causes a lot of problems in our body and a lot of diseases. Mainly, though, tonight what we're talking about is arterial stress and cutting down arteries and arterioles in our body and blocking them. So if you're healthy and you exercise a lot, you don't have to worry about that because you have a lot of blood vascular flow that's going through your body and the heart's beating faster. It's pumping more to all the different areas. Bill said something earlier about angiogenesis, or new blood vascular system that's built in your body after you've been in the hyperbaric chamber. This is important. They've been doing work years ago. I haven't looked it up for a long time, but anybody can look it up on the computer, that they were actually putting rings around some of the major arteries that go to the heart in animals. And they were cutting down the blood supply that was forced through these arteries that go into the heart. And they found that the body itself starts building what they call angiogenesis, or we call it collateral circulation, that builds around that one artery, builds other arteries to go to that part of the heart so the body functions, or that muscle keeps functioning with the proper blood supply. So they've been doing research for years about that. Now we know that through hyperbaric chambers, you can get in that and your body builds angiogenesis or extra blood vessels to other parts of your body, the heart being a muscle, and it's very important that you have a blood supply to that for the oxygen concentration.
So, I got a question about that, and Bill, feel free to answer, or John, whoever wants to answer this question. So, I had heard, angiogenesis doesn't start till after a certain amount of treatments in the hyperbaric chamber. Now, if that's correct about angiogenesis actually growing around these rings or whatever they were putting in the collateral, whatever it's called, around to get to make sure the blood is flowing right, would it make sense to, if you're eating a lot of food, things like that, maybe you have high cholesterol, something like that, something that could block your arteries or just not working out your blood vessels, would it make sense to, that a hyperbaric chamber might help? Or would it? Would it, wouldn't it? Who wants to answer that question? There you go.
Hyperbaric chamber, if it's building more blood vessels around the body, and where does it build most blood vessels? To any muscle that's under stress or strain. If you're working a muscle out more, and the heart, by the way, is always working, it never stops at night when we fall asleep. So when you're working a muscle quite a bit of the time and putting a lot of stress on it, it's very important to have extra blood supply go to that muscle. And that's what angiogenesis does in the body.
Cool. So here.
So John, if somebody has a cholesterol issue, or let's say somebody has a blocked artery, will angiogenesis work and build blood vessels around that blockage?
That's what we call collateral. That's collateral circulation. That's exactly what it does. If you have a blockage in an artery or an arterial, then what it does is this body builds blood vessels around that area, and by doing that, then it gets the blood supply back, the oxygen back to the muscle that's working. So that's what angiogenesis is to any muscle in the body.
So somebody's had a stroke or an aneurysm or something like that, then consistent use of the hyperbaric chamber is going to be of great benefit to them. Would that be an accurate statement?
Yes, it would. It's how soon.
I don't think it picked you up.
Okay, yes, I said yes. And a question would be, like, let's say an aneurysm someplace, which most often happens in the brain. If you have an aneurysm, the blood vessel isn't going to grow overnight. It takes quite a bit of time. So to behoove somebody to have angiogenesis being built all over their body, in their brain, in around the heart and so forth, prior to something like that happening. So if the more stress that you put on a muscle or on an organ in the body, and it has to build more blood vessels around there, the sooner the better. Not to be, wait until a problem happens, but to be proactive.
So based on that, and also based on, what Bill is saying and studies that have been done. So if you're in the hyperbaric chamber, angiogenesis will actually, will the process be sped up?
What was the question?
If you're based off of research that had been done, and because I've done a little bit of research on angiogenesis because of my own car accident that I was in, will angiogenesis actually the process of it and the way that the blood vessels get rebuilt, will that actually be sped up faster in a hyperbaric chamber than if you were just sitting out here alone? Can you even get angiogenesis without it?
Well, that's what the chamber does. It's somewhere between the 12th and the 15th session in the hyperbaric chamber, angiogenesis starts taking place. So you sitting there, it ain't gonna happen. Sorry to tell you, but But that's one of the benefits of the hyperbaric chamber. So here's the thing. We have talked in previous webinars about being proactive about your health instead of reactive. And you hear me talk about that. But we know that the hyperbaric chamber will severely reduce your risk of acquiring cancer, because cancer can't survive in an oxygen-rich environment. So if we keep our cells filled with oxygen, it will severely reduce your risk of acquiring it. The primary cause of cancer is a lack of oxygen at the cellular level, but it will also reduce your risk of stroke. And this is especially important to someone that's already had a stroke. I think the fear of anybody that's had cancer or had a stroke is the next bout with them. So if I'm sitting here and there's a history of cancer or a history of stroke in my family, I would personally be in that hyperbaric chamber as often as possible. But the issue here we're talking today is about heart disease. It's the same thing. I can't tell you how many men I've run into that are 45 or 50 years old and are saying, my dad passed away from a heart attack. I'm worried. And they're doing a lot of things to try to make sure that they don't end up the same way. And I would not stop any of those things, but I would sure add a hyperbaric chamber to it. Because if heart disease runs in your family, then I would be looking at a hyperbaric chamber. Educate yourself on what the chamber can do for you and what you can't do for you. And I think what you'll find is you'll be really surprised that something so simple can do so much for you.
Fantastic. So now we're gonna change pace just a little bit and jump back into some questions. So we're sitting around 30 minutes in now. So with everything that's been said, everything that goes around, I just wanted to reiterate about what we do. We started these webinars because we wanted to educate people on hyperbaric therapy, particularly, what it can do for you, but also we wanted to try to get in, some information about the disease, about the problem, and hopefully help you find a solution to that problem. So, Dr. Cornell, what are some different ways? Now, this is one of my favorite parts of the segment because next to answering questions for people, this is one of my favorites. So, what is one of the ways that or a few different ways that people can do to help lower the risk of heart disease, to help lower the risk of heart attacks, etc., and so on?
Eat less fat. Things that produce blockages in your arteries. Get some exercise. One of the main things exercise does, it makes you breathe harder. You get more oxygen in. Of course, it's only 18 to 22% oxygen that you're breathing out in the air. If you get in a hyperbaric chamber, you're breathing in 95% oxygen, which is getting more oxygen into your red blood cells and to all the organs. So the main thing is to be healthier, get some exercise, eat healthier, breathe healthier, and do all the things you could do to keep your body healthy. And then you won't have what they call an MI, a myocardial infarction, or simple word is heart attack, and all the muscles around that. So it's not just the heart muscle. A lot of people get pain up the side of their neck. They get pain down the left arm, mostly because it affects the left-hand side of the body most. When you're not getting oxygen to it, you start getting cramps, and that's where the muscle pain is. So those are good signs. Pressure on the chest. A lot of people say it feels like an elephant on my chest, and I can't breathe properly. So that's the main thing, is eat healthy, exercise, and stay healthy. Drink a lot of water. Wash the toxins out of your body. And of course, we promote Kangen water here because we all drink that, and it's revitalized molecular, smaller than the normal water molecule of H2O. You also get these molecules that are much smaller, and they're absorbed quickly in your body.
Okay, so now along with that, what are some of the foods, if you know, and you know, there's everybody has a different diet in their life. Everyone has something else that they have to, you know, that they're dealing with, and you know, some people like to eat a certain way. You know, you were saying, you know, eat less fats, things like that. But there has been proven that there are some fats that are good for you, and you know, some of those fats, I think. Oh, I can't remember the exact name. Like olive oil, and some of those fats are, you know, can help speed up your thyroid, can help you, you know, help your body increase in its digestion. Ice cream. So now,
Ice cream and milkshakes. Milkshakes, especially.
so Bill, let's talk a little bit about you. You know, we always bring this up, and I like to bring up Bill because he's had an interesting life, and the things he's had to deal with these last few years have been interesting, particularly with your cancer and all that. And you know what? There's a joke that goes around here, and I think, I'm not sure who made it, but it may have been Bill, if it was him or someone else. But it was talking about a hyperbaric chamber as a life insurance policy. You know, because he loves to enjoy life. So let's hear a little bit about that, Bill.
Yeah. I love my milkshakes. I love my cheeseburgers. I enjoy having a toddy on Friday nights. And I do. I seriously look at the hyperbaric chamber as my insurance policy. Whether I'm right or whether I'm wrong, I get in the chamber for an hour every day feeling that it is allowing me to live the lifestyle that I want to live. So, yeah, I do eat my cheeseburgers. I do drink my chocolate milkshakes, and I get pleasantly plastered every Friday night. So I jump in the hyperbaric chamber for an hour every day, and to be honest, I haven't had a cold in 8 years, and I've been using the hyperbaric chamber for 8 years. I had stage 4 throat cancer 8 years ago. Dr. Cornell also had about stage 4 throat cancer 6 years ago. So we use the hyperbaric chamber consistently, and I'm absolutely convinced that the hyperbaric chamber saved my life 8 years ago, and today allows me to live the lifestyle that I live. And again, I go back to talking about being proactive. Once I learned, you know, before I was diagnosed with cancer, I was invulnerable. I paid no attention to what I put in my mouth. And I owned a bunch of Burger Kings. My parents owned a Tasty Freeze. I was born and raised on the farm. So you can imagine what my diet was like. I didn't bother with the garden, but the cows and the pigs were important to me. So you can imagine. So once I was diagnosed with cancer, all of a sudden I paid attention to everything that I put in my mouth. Unfortunately, bad habits are hard to break. So the chamber, in my opinion, saved my life. And today I'm religious about getting into that hyperbaric chamber. So
That's awesome. That kind of brings me to, when you were talking just a second ago about the hyperbaric chamber saved your life. Well, that's saved your life, and that's the same for me. I was in a car accident. I was hit by a drunk driver. I had massive brain damage. I attribute all of my healing and where I am today to the hyperbaric chamber because I can think straight sometimes, and and I can make sentences. I can talk. I can communicate. These things I couldn't do back in 2008. I just couldn't do it, and now I'm able to communicate with people and talk. And that's, to me, there's nothing more important than being able to talk to people, and because I love talking. But so that, to me, it was really important, and that's why I'm so biased about the chambers. So let's go ahead and get into our questions section here. We have a lot of them. I said I wanted to start a little bit earlier on them. So I'm going to read off a question, and let's see if I can find the first one here. Okay, so the first one is from Jose. And Jose's asking, oops, here we go. How can the chamber help me after I've had a heart attack? What's the answer to that?
Well, if we go back to what the chamber does, it repairs and rejuvenates damaged cells. It's improving the blood and oxygen flow throughout your body, and it's building new blood vessels in damaged areas. The other thing is it's also increasing the production and circulation of your stem cells. Studies at the University of Pennsylvania showed that it increased the production and circulation of your stem cells over 800% after 40 sessions in the chamber. So I think that those things alone are a great part of repairing the damaged heart. But then in addition, it's also improving your immune system, which is helping if your body stays healthy, then it can help fight the battle also. So.
All right. So next, I got another question here, and this one's interesting. This is Michael. He's asking, how will the hyperbaric chamber help me in my recovery after a triple bypass? Who wants to answer that one?
Well, it builds the bypasses that you had in were actually, you were clearing a blocked artery, and the bypass then gets the blood flowing properly back to the muscle, that part of the heart that's, well, the whole heart is muscle, but so that's what it's doing. And angiogenesis that we were talking about helps by getting more blood vessel flow to the damaged area of the heart that didn't have oxygen going to it when it was working so hard. And the fact that healing happens a lot quicker, because we were talking about stem cells, and those are major cells in the body that function healing to any damaged or cells in the body that are damaged or not functioning properly. It gets them functioning. So it's proper to get good oxygen supply, so the blood vessels that are healing can heal faster. It helps build angiogenesis, so the new blood vessels around the area are getting to the muscle that hasn't had a lot of oxygen to it. And so those are two of the main things that are very important in your recovery.
All right. So now, hopefully your questions are being answered right now. If not, we're going to get into here after we got a couple more questions. Then we're going to get into how to contact us, where to go, and all that stuff. So next, I got a question from Jessica. She's asking, I was told the pain is different for a woman than a man when having a heart attack. What is the different signs to be aware of?
Now, the pain, different levels of pain. That's true between a male and a female. But a woman will feel some pressure on her chest. normally around the sternum, a little bit more to the left. She may have the muscles on the left-hand side of her arm, or going up the left-hand side of the neck. You may feel some pain up there. The symptoms are similar between male and female as far as the textbook goes. It's just saying that the amount of pain may differ between a male and a female. It doesn't say by 60%, 40%, or whatever. But those are some of the symptoms that you could be feeling. Chest pain, pain on the left-hand side of your body, your arm, numbness in the arm, numbness or pain going up the side of your neck, left-hand side of your face. Sometimes will become numb, or you'll have pain in that. So those are the major symptoms.
Okay, now this one more question that I haven't seen anybody bring in, but I thought it was pretty interesting myself, is we hadn't really talked about scarring and surgeries on the heart and things like that. Will the hyperbaric chamber help reduce the amount of scarring on your heart if you had open heart surgery or something like that?
Well, that's one of the reasons so many plastic surgeons have hyperbaric chambers in their facilities, or recommend hyperbaric therapy for their patients, because it does reduce scarring. I was in a airplane accident. I dumped my airplane flying into a small strip, and as a result of that, I had a huge scar across the side of my face here. And I hadn't even thought about it, but a couple of years ago, we were at a trade show, a health trade show, and a lady came up and said, "I heard that the hyperbaric chamber helps reduce scarring." And I started going into detail about the fact that, yes, that's what it did. And I said, then wait a minute. I said, do I have a scar here? And she looked and said, no. I said, I hadn't even thought about it, but I used to have a huge scar right here from an airplane accident I was in, and it's gone. So it's widely promoted that the hyperbaric chamber will reduce scarring, reduce wrinkles. Spider veins are a circulatory issue. So the hyperbaric chamber is very popular with plastic surgeons that know what it can do. So it will reduce scarring. Here's an interesting question. What about scarring from cigarette smoking? What do you think, John?
Are we talking about scarring in the lungs? Yeah. Well, if it helps scarring externally, it'll certainly help scarring internally. I mean, there's a lot of factors in it. Fibrotic tissue is what causes cicatrix, or scar. That's another word for it, in the body. So I think that if it breaks down the fibrinogen and rebuilds new tissue with stem cells, obviously to get rid of scarring. And that scar that you had on the side of your face, it isn't noticeable when you look at it. But if you smile a certain way, you could see where there was something at one time, but it's not noticeable externally.
Well, thanks for breaking that bubble there. So, no. So we're nearing the end of our webinar here, and I wanted to touch a little bit on. We're going to talk a little bit about the hyperbaric therapy and our businesses and how it helps, what we can do for people. So let's start, Bill, we'll have you go and explain about the hyperbaric chambers, the different businesses, and how people can get treatments and help from that, along with your numbers, emails, and contact.
Here's the thing about hyperbaric therapy. It's amazing something so simple can do so much. But frequency is an issue. So we operate a chain of hyperbaric clinics. We treat people all the time, but many of our patients and many people throughout the United States actually elect to buy a chamber and put in their home. And there's two reasons for this. First of all, frequency is an issue. So many people can't commit to taking 2 to 3 hours out of their day every single day to come in for treatments. So it's much more convenient for them to buy a chamber, put in their home so they can get in it when they want. You're not getting in the chamber for 2 to 3 hours, but by the time you drive there, get in the chamber, drive home, you're out 2 to 3 hours. And to see the benefits, consistency, frequency is an issue. You're not going to see the benefits if you get in 2 or 3 times a week, if you're trying to treat a severe inflammatory issue. So we have one side of our company that provides treatments. We have another side that sells hyperbaric chambers. And if you have any questions on what the chambers can do, what they can't do, or if you want a chamber in your home, you can call me at any time at 253-363-0500. If you want information, we have information. We have a lot of files we can send you copies of. So we're here to help. We're here to educate. So feel free to give me a call, 253-363-0500.
Awesome. With that being said, you can get a hold of me anytime at 206-794-8229. Again, 206-794-8229. I wanted to add just a little bit to that. We have a couple different websites. The first website is h3oxygentherapy.com. You can go there and find out about our clinics, find out what what chambers can do. There's some information on there. We also have another website. It's alaskahyperbarics.com. And that's our chamber sales website. So if you're interested in maybe purchasing a chamber and you feel frequency might be an issue, you can go over to that website and send us some information. We'll, Bill will get back to you, or John, or whoever is free that can take care of your situation, because everybody's situation is different. So feel free to go into check out our websites. We also have our Facebook. It's H3 Therapy. On Facebook, just look it up. It's pretty easy to find. We have a ton of information that we release on there every single day about what we cover in our webinars, along with information throughout the day that we find, or different articles we found on different what hyperbaric therapy can do for everybody. So, John, let's go ahead and get your contact info there.
My contact info is 253-549-1271, and you can call me anytime, and I can answer any questions you'd have about any illness in the body, basically, that's inflammatory, to reduce the inflammation and to get you back to a healthy state. So my number again is 253-549-1271.
Perfect. So now, before we wrap it up here, I just want to let everybody know, what we're talking about today is going to be on our Facebook tomorrow too. Excuse me. So we'll have some more information. The things that we talked about today will be on, we'll have it updated on our Facebook tomorrow, along with some other research that had been done. So you guys can go back and browse and say, oh, that's what they were talking about, or, compare and look at statistics. So any last comments you guys like to make, or we're going to go ahead and wrap it up, I guess. Go ahead, Bill.
One of the things that's important is you pass this information along. More and more, every month, more people are finding out about hyperbaric therapy. But we're still in a process of education here. So if you have a loved one or a friend who has cancer, or had a stroke, or had a heart attack, or has an autistic child, or MS, or Lyme disease, pass the information that you're learning on, and please ask them to look into hyperbaric therapy.
And really, you're exactly right, Bill. That's one of the biggest things on how we can spread what hyperbaric therapy can do, by just telling other people about it. So, great addition to that, Bill. So, all right, everybody, stay tuned. We're going to release on our Facebook tomorrow what we'll be covering next week, and we hope everybody has a fantastic week and stay heart disease free. We'll talk to you later.